So today we'll be talking about the medicine which is called Ivabradine, the drug. Now, Ivabradine is one of the most important drug for cardiology because it is not only anti-anginal, but it also reduce the heart rate. Now, we know that the patients with acute coronary syndrome or MI, STEMI, or stable angina, they very commonly have increased oxygen demand. They very commonly have increased LVH. So, more is the oxygen demand, more is LVH, more is the chest pain. So, and in that, if the patient's heart rate is more, then definitely these patients tend to have more oxygen demand and the patients have more chest pain. So, in that scenario, if the heart rate is more, by reducing the heart rate, it can definitely markedly improve the chest pain. So how they act is they block the cardiac pacemaker, that is SA nodal F channels, which are called funny channels. Now these funny channels actually don't have any negative inotropic activity. So there is no reduction in any contractility, but it simply reduces the heart rate. So automatically the patients, they have a better prolongation of diastole. So there is increased perfusion, there is increased left ventricular filling, and it has definitely better myocardial perfusion. So reduction in the heart rate is there, reduction in cardiac oxygen demand is there, there is improvement in the diastole, and there is improvement in muscle perfusion of the left ventricle, so it automatically reduces the chest pain. So it very commonly improves the exercise tolerance because there is better diastole, and it reduces the angina frequency, so there is reduction in the chest pain frequency. So, whenever the patient have a heart rate of more than 60, this drug can be considered. Usually, if the heart rate is more than 90, this drug is very commonly considered to reduce the heart rate below 90 so that the heart rate can be targeted in between 60 to 90. It very commonly can cause bradycardia, so the drug should not be used whenever the heart rate is less than 60. If the heart rate is irregular, that is, if the patient has atrial fibrillation, or if there is six sinus syndrome is there, there we should not use drug at all. The common side effect of these drugs is bradycardia, visual disturbances, extrasystole, and prolongation of PR interval. But most of the time, this drug has to be carefully monitored time to time, and these symptoms are not a problem. This drug is best for the chronic stable angina because we have already mentioned how it works. This should be considered for those patients who are beta blocker intolerant because to reduce the heart rate, we should always consider beta blocker as a first drug of choice because they not only reduce the heart rate, they not only reduce the oxygen demand, but they have also shown to have survival benefit. So they had shown to improve the cardiac mortality. They have reduced the hospitalization rate because of the heart failure, and they markedly help at renin, angiotensin, aldosterone system as well. So beta blocker should always be the first choice, and if they are intolerant to beta blocker, or where the beta blockers are contraindicated, like for asthma, COPD, acute V's, then this ivabradine should always be considered. The beta blockers are very commonly absolutely contraindicated in acute LVF where there is tachycardia. In that scenario, this ivabradine can be given because these drugs are not contraindicated even in acute heart failure where tachycardia is there. Very commonly, this drug is available in tablet form. We can start with 5 milligram twice a day, and as if needed, we can increase the dosage to 7.5 milligram twice a day. It has pretty decent bioavailability of 40%. So this is one of the excellent drugs which has an anti-anginal property, heart rate reducing property without any inotropic effect, which has shown to reduce the heart rate, reduce the cardiac oxygen demand, better diastole, and better myocardial perfusion. And that's all for now, and thank you so much.